Hello, I'm your host, Neil Howard. Glad that you could join us on the program once again. In this segment, we're going to be talking with Texas-based surgeon Dr. Chuck Page, and he's joining us on Health Professional Radio to basically talk about how bad the COVID-19 pandemic could get. You know, it's bad right now, but he's going to talk about how bad it could get and how some people are still ignoring safety precautions. Welcome to the program, Dr. Chuck Page. Thanks for taking the time this evening.
Thanks, Neil.
Right. Well, a bit of your background. What is your area of expertise there in Texas?
So I'm a general surgeon. I serve in an underserved area. Mm-hmm. I do a wide variety of surgery. So I pretty much do everything from trauma to cancer surgery to endoscopy. You name it, I do it in a small rural area.
Mm-hmm. Being in a small rural area in the wake of this COVID-19 pandemic, what changes are you seeing?
Well, so first of all, you know, it's a little bit different beast in small rural America than it is in the big cities. Mm-hmm. And the issue is resources. We just don't have the resources that, say, a place like New York has. And so one or two sick patients can really put a burden on our hospitals. In fact, you know, most rural hospitals are working in the red anyway. So canceling our elective surgeries has really hurt the revenue of hospitals that are already kind of struggling to begin with. So it's really putting a strain on the system. You know, one of the other differences is that, you know, physicians are a valuable resource, you know, specialists like pulmonary critical care doctors and, you know, internists are hard to come by in small areas. So if you get one sick doctor, I mean, it really can really put a drain on the system. And so, you know, for example, we're in Nacogdoches County, which is in East Texas, and we've had about, I believe, about 8 to 10 deaths. And we actually have more cases than some of the more, you know, as far as, you know, numbers are concerned, some of the bigger areas in Texas. And so, you know, it's really a bigger challenge for us.
You know, we hear so much about when we can get back to quote unquote normal. I personally don't think that is going to happen because things don't normally go back to normal after something this significant. How bad is it going to get? Because as bad as they're saying it is, you've got to know that it's worse. So how bad do you think it's going to get, you know, based on your experience?
Well, fortunately, it's not going to be as bad as what was anticipated. You know, initially it was 2 million, then it was 120,000, and as the assessments, you know, continue to come through, the numbers are going down. Right. But I still think we're going to see probably 80,000 deaths, and it's not only that; it's also the morbidity associated with this and the economic losses, as you're noting. And I think you're right, Neil. I don't think it's just going to, you know, come back tomorrow. I think we're going to see a slow, you know, hopefully a slow and steady, you know, recuperation. But I think it's going to take 3 or 4 months.
It's almost as if many of us have forgotten that a death toll, just the loss of life in any situation, a situation that causes this type of loss of life, nothing ever goes back to normal. We thought that we were going to be dealing with TSA at the airport on a temporary basis. That turned into, you know, the new norm.
Yep, I agree. Mm-hmm. I agree. And not only that, you think about the people that are the caregivers, mm-hmm. the ones that are going to be taking care of those people who didn't die, but they're still sick. I mean, it's going to take a long time for these people with respiratory issues and, you know, resolving from ARDS to get over this. And then that's going to work into our, you know, into our nursing homes, into our skilled nursing facilities. I mean, there's going to be a lot of ramifications of this.
You know, you're talking about ramifications. We're hearing across the globe about countries being in total lockdown with curfews, you know, of sundown. After 14, 28 days, what happens when the doors open? Because things are still going on. We still have domestic violence. We still have child abuse. We still have people's homes catching fire. We still have floods. We still have other illnesses other than COVID-19.
I agree. And we still have sick people coming in the hospital with appendicitis and, and, you know, they have other medical problems, heart attacks, all these things. And so, yeah, it's crazy. You know, here's the thing. We can't stop a virus. No. And so the whole strategy here with the flattening of the curve was to decrease the number of people, that were so sick that it was going to overwhelm our ICUs and our ventilator capacity. And so I do think that we have succeeded in that area. But I do think one of the things, when you slow down the spread of the virus, that means it's going to continue to spread just at a slower rate. And so we're going to see this. It's just going to draw out some of the challenges over a longer period of time.
Now, as the author of a book called A Spoonful of Courage for the Sick and the Suffering, Transforming Your Greatest Challenges into Your Biggest Blessings, this is one situation by far that, you have to look for the silver lining. You have to look for a blessing in this, because as challenges go, this is it.
That's right, Neil. It could always be worse. And that's what these stories are about. I've learned to listen to my patients over the years. And kind of what I've observed is that, the impact that faith makes in the life of a patient as they, begin to look upward instead of inward. I mean, we all have these feelings of, even I've had these feelings of feeling alone, feeling inadequate, feeling out of control, and just going back and looking at our faith and looking upward and having hope and courage makes all the difference. But I'll tell you something, Neil, the people who seem the best in a crisis like this are people who begin to look outward. They look for ways to encourage other people. And those are the people who tend to do the best. And so that's what this is about. These are just stories. And just to remind us, like 3 years ago, my office building burned down. And man, I was throwing a pity party, and, I was still on call and still working. And what really encouraged me the most were the stories of people, the pat on the back, even the spiritual platitudes, God's got this, and, God's all things work for good. Those things, yes, they're true, but they weren't helping me very much. But when people told me their stories, it really made a difference. In fact, there was one man who told me, he said, "Doc, my house burned down, and my wife was an invalid. I was her caregiver. And as the house burned down, I couldn't get her out. And I had to watch the house burn down with my wife inside." That was an attitude adjustment for me. I realized I had nothing to complain about. So what these stories kind of are designed to do is help us to change focus and stop looking inward and begin looking upward at the facts, the fact that God really does love us. He is all wise, and he knows better than we do. And he's going to give us the courage and the power to get through whatever, we face.
Let's talk about what you say to the folks who are acting as if nothing is happening. Faith is one thing, but this is something that is happening, and it doesn't consider faith.
Yes. And, one thing about faith is that we look outward. We consider the well-being of others above our own, and I think that's one of the important things. And I see people every day. I saw a guy at the store the other day who wasn't wearing a mask, and he was one of my patients, and he was picking at me because I was wearing my mask. And, and I just had to remind him, it's really not about you. Wearing the mask is not about you getting the disease. It's about you transmitting the disease to someone else. And so we have to be considerate of other people. But yeah, I see that all the time, and I see people coming in. I had a patient in the office with a fever and a cough, and he went to the emergency room, and they didn't test him. That's before we had all the tests available, and he came in the office and didn't tell us. It's pretty inconsiderate to the other people who were in the office, So there's a lot of people that are sweeping this under the rug. On the other hand, there are a lot of people that are overreacting to this. I think a good balanced view of this is key. What we see on the TV, from the ICU doctors and the ER doctors, that's just the tip of the iceberg. We've got to remember that 80 to 90% of patients who have this are going to have minimal symptoms. And so we have to kind of keep that big picture in mind. What we don't see the interviews is the primary care doctor who's seeing 4 or 5 of these cases in their office every day that are doing fine.
We hear so much bogus information. Talk about this malaria medicine that's touted as a treatment for COVID-19 as we wrap up.
So there's a lot of literature now which is finally kind of coming out that's supporting this. So the initial study that came out of France was a very small study. Hydroxychloroquine or chloroquine and a Z-Pak or azithromycin were shown to help. And actually these studies are kind of beginning to confirm all this. There's a bigger study that came out of France, and then a bigger study that came out of China that supported this. And what we think is happening is these malaria medicines they kind of inhibit the virus from attaching to the cells, at least for a short period of time. And so it slows down the rate of transmission and gives the body time to kind of kick in the immune response. But also, like, for example, Plaquenil or hydroxychloroquine is a medicine that's given for lupus patients. And what it does is it alters the immune system. And so if you think about it, it seems like there's a small proportion of patients who their immune system just goes berserk, and they get this hyper reaction in their lungs, this interstitial pneumonitis. And so the Plaquenil kind of modifies that, kind of blunts that a little bit so that we don't get the immune response. Sometimes the way our body responds to the infection is even worse than the infection itself. And so that's kind of the theory of these medicines. But we're also coming up with new stuff. I mean, the plasma, and hopefully everybody's arguing, well, are there people that already have the disease we didn't know about? And there probably are. And, to get those people and to get, blood transfusions for the people who are really sick, is probably going to be the next wave of this.
Well, Chuck, give us a website where we can get more information about you and about your book, Spoonful of Courage for the Sick and Suffering, Transforming Your Greatest Challenges into Your Biggest Blessings.
At the present, you can download the book, the ebook, for free on Amazon. My publisher decided that everyone needed a little dose of hope, courage, and faith. And so it's free on Amazon right now, just to download. You can find more information on charleswpage.com. We've got a podcast, and we've got all kinds of freebies there. You can get some pamphlets that you can print out and give to someone, who's going through a health crisis, to kind of give them as a free gift. So we've got a lot of things that may be a benefit for you in this time.
Great. Matt, Chuck, thank you so much for joining us here on Health Professional Radio this evening.
It's great talking to you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Chuck Page, talking about how bad the COVID-19 pandemic could get and how to survive it. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube page at youtube.com, Health Professional Radio.